Get ready to lose an hour of sleep this weekend. Daylight saving time begins on Sunday, March 12th. That means most Americans will need to set their clocks 1 hour ahead. It started in the 1960s as a way to save energy because the days get longer in the warmer months. But some specialists argue the change can have a negative impact on your health. We're joined by Dr. Beth Ann Malow, who is a professor of neurology and pediatrics at the Vanderbilt University Medical Center. Doctor, thanks for being with us. In a San Francisco newspaper, you write there are health risks associated with daylight savings. Tell us what you found.
Well, it's work that many of us have done. And what we see is that when we move our clocks ahead, there's a jolt to the system. It can affect not just how we feel in terms of being tired and sleepy and losing that hour of sleep, but it can also affect heart attacks and strokes. There can be an uptick in those things, as well as traffic accidents. It's going to be darker in the mornings come next week, and that can take a toll on our health too.
Are there natural health advantages to that morning daylight?
Yes. So right now we're on standard time, and that maximizes morning light. It comes at the price of darkness later in the day, but we as health experts pretty much unanimously feel that that morning light is the healthier choice for us. Standard time is the healthier choice, and that's because morning light wakes us up, gets us going. It actually synchronizes and organizes our internal rhythms with what's going on in the outside world. It aligns us in that way, and that helps our mood. It helps us get to sleep better at night even. And all of that is super important because sleep really impacts our health in so many ways. Our weight, our mood, our heart, our lungs, our brain, that's all affected by good sleep.
So I take it you're in favor of standard time year-round.
I am. I'm in favor of getting rid of going back and forth, which I think most of us are.
100%.
Yeah.
People are so cranky with the change. I get it.
Absolutely. No, I want to get rid of it too. And I mean, that's where I think we all agree, or many of us agree, we want to stop going back and forth. I think the challenge for our country, it's a trade-off, right? People want the dark, they want the lighter afternoons and evenings, but that light in the evening actually can come at a price to our sleep. So we believe as medical experts that having the light in the morning is the healthiest choice for us.
You've testified to Congress, but I'm going to ask you to kind of predict what's ahead. Could you see a scenario where, each state goes its own way, like Hawaii and Arizona, who don't observe daylight saving?
Well, it's really interesting politically because you can opt out of being on daylight saving time and adapt year-round permanent standard time. And that's exactly what Arizona and Hawaii did. And I think they're very happy with it because it's super hot, right, in Arizona and Hawaii, and they don't want that afternoon heat. They prefer to play golf in the morning and do those things like that. I think it really should be a state choice or a region choice because I think it works best for regions of states to decide what they want to do. I think that it's very wise to allow states to opt out. And there are just some states that would be really, really dark. For example, Minnesota and Michigan, and there's other states that are on the western edge of our time zones. And sometimes it's not even light in the morning until 8 o'clock in the morning in January. And if we went to permanent daylight saving time, it would be close to 9 o'clock where we would see sunlight. And think about the kids trying to go to school in the dark. We actually tried daylight saving time in 1974. We tried permanent daylight saving time, and it really was not popular, and it was repealed early. In Florida, there were some fatalities. So kids were going to school in the dark, and it was very dangerous. And their parents basically pushed for it to be repealed early, and it was. So I'd hate to see our country make that mistake again.
Wow, this is a subject we can all identify with. Dr. Beth Ann Malow, thank you for your expertise.
You're very welcome. Thank you. Get some sleep this weekend.
I will. I will. Thank you.